Hi, I'm Babette Edgar, and we're here today talking with Joan Siegel about the future of managed care pharmacy. Joan, could you tell us what you do, where you work?
Yes. Right now, I am currently working for a biotech company, biopharmaceutical company, in the plasma protein space, and I work in an area called managed markets. So primarily working within the payer community and specialty pharmacy and payer community. And I've been actually, though new to this side of the business, I've been on the actual payer side and especially pharmacy side for many, many years.
How long have you worked in managed care, roughly?
Oh my gosh, since about 86.
Okay. So you've seen a lot of changes with managed care. So we're talking a little bit about the future today, and with all the changes with healthcare reform and financial issues, and just trying to think a little bit about managed care pharmacy and perhaps where you see managed care pharmacists practicing in the next 5 to 10 years.
I think that's a great question. I really believe that I'm a true Wayne Gretzky fan, and it's funny because actually someone used that today in a session, and I've been saying that pretty much my whole career. Go to where the puck's going to be and not where it is to get your best outcome. And I think that's part of it. I think we're looking more at outcomes and evidence-based medicine and just overall good treatment and treatment protocols and a variety of things. And I think so we're going to see a lot of those kinds of things starting to branch out within the managed care space, because that's where a lot of the information is available and the opportunity. And I think we're going to see pharmacists and be much more involved in those kinds of things. I think it's important. I think they have such a good grasp of pharmacists on the patient and the patient interaction, and so what outcome looks like for patients, what a health status looks like, what a healthy person might look like, and what's important. And I think I think we're going to start seeing that be a space where we might have an opportunity to see more and more pharmacists practicing and managed care places practicing. I also think just really in the industry in general, in that we hear a lot of talk right now about the ACOs and what's happening there, and we know there's not a lot of definition completely surrounding it yet, although it's being worked on. And there's also sort of, depending on who you talk to or what you see, sometimes you see that maybe pharmacy's a little separate right now or in the outskirts of some of the ACOs, but I think the idea, and I think what we're starting to see more and more, is that the pharmacist will be more and more involved in those kinds of things. Because again, a pharmacist is one of the people that actually touches the patient. And I think that's so key in managing care. And that's what managing the care for people is really touching the patient. And they're one of the folks besides your actual physician provider or nurse practitioner, or other clinician type person that really has an opportunity to touch the patient.
So, that's a big change since 20 years ago. Do you think that pharmacy curriculums and pharmacy education and residencies have kept up with being able to train our new practitioners to actually function in those types of roles?
Again, that's just such a wonderful topic, because this morning I just had the opportunity to sit with a group of students who were P2s and P3s in pharmacy schools, and we actually had this exact discussion, talking about their preparation of understanding managed care and understanding the different components and and the treatment that takes place as a managed care in the role of a managed care pharmacist versus some other settings you could be in. And they were actually saying that they really don't get much training. They might have an opportunity on a residency, to be able to go in, but in actuality, as far as the curriculum, that they see a strong need. And I just completed a master's program in pharmacy myself, and I thought it was very interesting in that there was maybe a little more about managed care in general, but still so much of the program was really just more functions of being in the pharmacy field versus the actual understanding of managed care and specialty pharmacy and managed care, another very big part of it. So I think there's opportunity. I look at that as opportunity for more and more curriculum out there. I think AMCP is probably in a great position to help with some of that kind of curriculum. So I think there's opportunities there that we just really need to start working on.
And what do you think about specializations within managed care? Up until now, we have managed care residencies. They're pretty broad residencies. They're in PBMs, they're in health plans, they're in a couple other situations. But it seems that managed care, as it evolves, you have Medicare, you have Medicaid, you have outcomes, you have patient-centered medical homes, you have accountable care organizations. Do you think that in the next 3, 5, 10 years that managed care is going to need some specialized residencies as well?
Yes, actually, I think that's a fantastic idea, and I think we're starting to see a little bit of that. They may not be calling it that today, but I think we're starting to see some of that because there is opportunity. I know for some folks to go in and work in government settings, when they're doing their residencies, there's opportunities to work in maybe just in a Medicaid plan. So I think there are some of those kinds of things, but I think that's really important because it is very challenging to work in some of those spaces if you don't have a good foundation for them and education and because Medicare, Medicaid, as you know very well, those spaces are going to be growing. Okay, baby boomers for Medicare and Medicaid's expansion.
Yes.
So I think we're going to see a lot more of that. I think we're going to see a lot more of managed Medicaid, especially at the state. In our state programs are moving to that. I live in a state where that is really where they're totally pushing pharmacy. And so I think those kinds of things will be important, and I think for people to have expertise in those areas as a pharmacist and use that as a career path, I think will be fabulous.
Great. Well, thank you so much for your time today. We really appreciate it.
Okay, well, thank you. Always a pleasure talking to you.
Thanks.